I think now we're going live, and I'm also going to hit record.
Yep.
All right. So do you see that it's recording, Angela? Or
Yes.
either of you? Okay, great.
Yeah, all good.
And then I think I'm going to try and go to the group, and I think we should be live in the group.
We are.
Okay, great. Awesome. Well, welcome everybody, whoever's here. We'll give everybody a few minutes to kind of jump in and join us. This is our evening, monthly, I guess it's beginning to be, get together to have our expert interviews. And tonight we're having Dr. Aaylah Wellspring, a naturopath here in Durango, Colorado, to talk about hormone testing, which is definitely a topic that I've seen a lot of questions come up around, and I would love to learn more. So we are so grateful for you to be here. Thank you.
Thank you.
And this group, we began it, Angela and I began it not too long ago, actually, just out of a conversation that we had. We were both kind of experiencing perimenopausal symptoms and going through our own stuff and talking about how there wasn't a ton of information out there, and especially that we felt really that was accurate and reliable, and also a community that women can get together and just have a safe space to talk and to feel like they can share and ask personal questions and feel like they have a place to connect. So that's why we started this Facebook group, and then from there, it just keeps growing and we keep getting ideas, and now we're having these fun talks. So I am going to check just to see if anybody has come on. And if anyone does, if you can just maybe post a comment or tell us if you can hear us, that would be awesome. I know there were several people that were saying they were interested in this talk for sure. So since it's about 3 after though, this talk will be recorded, so you will be able to go back at any time to watch it at a later date. And even after the recording, if you have any questions or comments, please put them in the comments and we will address them at a later date too. So I would love to just go ahead and introduce our awesome guest, Aaylah Wellspring, like I said, who is a naturopath here in Durango, who I have actually worked with a little bit, and we have mutual clients, and I just have a great amount of respect for you. So thank you for joining us tonight.
Thank you.
And Aaylah, if you want to give us a little bit of your background, that would be great.
Yeah, so I'm a naturopathic physician, which for those of you that are not familiar with what a naturopath is, essentially we're a primary care physician that has extra training in natural medicine. So in addition to pharmacology, we also learn about nutrition, chiropractic, botanical medicine, homeopathy, physiotherapy. I mean, the list goes on and on. So we have an extra large tool bag, I like to say, for working with patients. And within that, so I do primary care, but my specialties are hormone balancing and women's health, and then also gastroenterology. Those are kind of my two loves, my two specialties. And I also, before becoming a naturopath, I worked as an herbalist. Actually in town, I managed Dancing Willow for a couple of years. And so I have a lot of extra training in herbs, even above and beyond my education. And I really love working with herbs when possible. And yeah, I think that's most things with me. In terms of my education and training, I have a lot of my undergraduate, I did cell and molecular biology and biochemistry. So I have a lot of chemistry background too, which is nice because that's kind of how my brain thinks, is like, I like to understand the underlying physiology of things, but then using natural remedies if possible, but I'm not opposed to using other types of treatments when necessary. But in the state of Colorado, we don't have prescriptive rights. In other states, we would, like in Oregon or Washington. So, yeah.
Awesome. Thank you. And our topic tonight is hormone.
I love working with herbs when possible. And
Sorry about that.
I think Susie's got the phone unmuted. We're getting a little echo. There we go. So tonight, I think our topic is, or I know our topic is hormone testing, which is a big topic. When we kind of talked about it at first, there was a lot of directions we could go. So I just want to start with maybe where you want to go with an overview of that.
Yeah. Okay. Well, I would say that I guess in general, I know that some women maybe tuning in tonight will be perimenopausal or not sure if they're transitioning into menopause, and then other women, have been dealing with it for a while, and they're sure that they're menopause. So just sort of as a kind of definition of menopause, I would say menopause is technically, it's been a year since your last menstrual period. So it doesn't count if you went maybe 3 or 4 months, even 6 months or 8 months without a menses. But if you got a menses, you kind of start all over again. So it's essentially 12 consecutive months without a menstrual cycle would be the definition of menopause. Months without a menses, but if you got a menses, you kind of start all over again.
I don't know why.
Sorry, we're still learning technical pieces.
Yeah, exactly.
To make sure you understand that very important definition. Yeah. So, I think the kind of women, I would say the biggest thing to kind of know about that transition is it is really important to sort of look to your mother. If you know your mother's history, sometimes women are adopted or they don't have a good connection, or their mother just never talked about anything like that. But if you happen to know when your mom went through menopause, that is a good indicator of when you might expect to go through it. Sometimes women have hysterectomies and whatnot, earlier before they have a chance to naturally go through menopause. So that also would interfere with you knowing an accurate timeline. But that kind of helps to give you a time frame. And there are other circumstances why you might veer from what's going on with your sort of genetics. But for the most part, that's really helpful just to kind of keep in mind when things are changing. Women often, the most obvious symptom is that your menstrual cycle is altering. And maybe your cycle length is changing. Maybe it gets shorter, maybe it gets longer. Maybe you skip months. Maybe the amount of bleeding, which maybe had been very consistent before, is now lessening, or it can even get really heavy. It just can go all over the place. The other thing that a lot of women notice is weight gain around the middle. That's a really frustrating symptom for women. And even when they're still menstruating, that can be one of the first indicators. And they're like doing the same type of exercise and eating, but they're noticing that weight is accumulating in the middle. Sometimes, mood changes, sleep problems, hair loss, thinning, especially, the hair over your vagina, when that starts thinning, that can be really difficult for women. That's kind of a symptom. And of course, hot flashes, the pretty classic. Sometimes women get a little confused by those because maybe it's not as dramatic as they had heard from other women. Maybe they'll just get a little hot in the night. But they're not getting this really extreme, flush, which some women can have really bad. So that's sort of the basic understanding of, things are shifting, and And then, in my situation, women often come in and they kind of want to know where they're at. And so if you're past the point of you already know you're not wanting to have kids anymore, then if you're still wondering about having kids, then obviously a good reason to get tested is to see if you're still ovulating, because actually you can be more fertile right in that perimenopausal time. It's like the body's last ditch effort, and sometimes there'll be multiple eggs that are released in the same cycle, so your chance of twins can go up and stuff like that.
Oh, wow. I
um,
didn't know
yeah, yeah. So be careful. Don't throw away the birth control yet if you're, not sure if you're definitely don't want a family beyond what you already have, if you do. So, yeah, so in that case, a woman might want to know um, if she's still ovulating, because you can have cycles but actually not be ovulating. The other reason is, particularly in my situation, why I really like doing hormonal testing is because it can help guide treatment. So if a woman's not doing anything already and she's having a lot of symptoms like hot flashes, when I look at the hormone testing, which I'll show you a couple examples a little bit later, but you can kind of differentiate between an ovary that's still functional, but maybe has not putting out a lot of estrogen, versus an ovary that's pretty much done. And when the ovaries are done making hormone, you're still getting hormone. You get it from the adrenals. It's just such a small percentage compared to what you would be getting from your ovaries. So in terms of giving treatment, if a woman is still making some estrogen, but it's low, then it's a lot higher likelihood that if I put her on some herbs that help stimulate the estrogen production, the natural estrogen production, they'll be effective. I'll tell you that it's all over the board with how women respond to treatment. So not all women respond to herbs, and this is one of the ways I've been kind of able to help to differentiate. Of course, you could always just jump in and try, but yeah, that's one way that I can see. And then also I often, in addition to a hormonal panel, or in addition to the sex hormones, I'll also look at cortisol, which is another hormone, and that's kind of an indicator of how your adrenals are functioning. And they are also making some sex hormones, small amount of sex hormones. So you can kind of tell by the cortisol how functioning your adrenals are and if they need more support. So say your ovaries are not producing a whole lot and your adrenals are pretty tapped out, then well, okay, we got to really focus on restoring the adrenal health to help the body make its natural stores. Or, you might be a really good candidate for bioidentical hormones, because especially if we've tried herbs and they're not responding. So, and then of course, if you're on bioidentical hormones or any kind of hormones, unfortunately, I don't see doctors really keeping up with testing on that. Woman has symptoms, they put them on hormone, maybe they do one test follow up, maybe not. And I've had a lot of women come in actually on too much hormone. And so I've had to, and then they get spotting. That can be one of the symptoms of too much. So knowing if you're in the right balance, and kind of the risk of being on too much hormone is are you clearing it in a safe way? And if not, it could put you at a higher risk for developing some type of cancer. And that's whether or not you're menopausal or perimenopausal or still menstruating. That's another really significant reason I like to do hormone testing, is especially the kind that I like to do. I can look at the downstream metabolites, how the hormones are broken down, and I can see if it's being cleared down a healthy pathway. And I know I'm just kind of like rambling, so if you guys want to jump in with any specific questions, let me know. I'm just sitting in.
Well, I'm just curious, you're bringing up, like, it sounds like you use a lot of different avenues to treat and you look at a lot of different things. Um, you know, and you may do supplements or herbs. I'm sure there's other things you look at also. But if someone is on like bioidentical hormones or a different type of hormone, are there different types of testing you use to monitor that then? Or I know the Dutch test is something that you like to use when assessing. Would that still be what you would use when you're trying to monitor bioidentical hormones?
Yeah, absolutely. And even more so. So to kind of just give you a basic understanding of when you would use the two, if you are wanting to just look at basic sex hormone status, you could do that with blood work. And that's just a snapshot in time. It's one point in the day. It is covered by insurance, so sometimes it costs you nothing, or is very minimal. It's easy to give the sample, and especially if you're in menopause, your hormone levels are not fluctuating as much, and especially not throughout the month. So it's much cleaner that way.
Okay.
If you're a menstruating woman, you have to time it in your cycle. And your hormones do fluctuate throughout the day, especially with menstruating females. And so my preferred method of hormone testing is the Dutch test, which is actually an acronym. It stands for dried urine, blah, blah, blah. I don't remember the whole thing actually, but essentially it's called a urine spot test. It used to be that urine is the gold standard way to look at hormones because of a couple reasons, which I'll explain. But it used to be that you would actually have to collect your urine in a jug all day long. You'd have to carry it around with you for 24 hours. And the test was like $800. And so needless to say, doctors rarely would order that test just for convenience and costs and all that kind of stuff. But what's great about the Dutch test that I like to use is that it's 4 collections. So it's throughout the day at different time points. It's maybe not quite as accurate as if you were collecting throughout the whole day, but they've figured out ways to kind of figure out.
I did it again. I'm trying to look at the comments here.
Yeah, they figured out ways how to sort of average it out and figure out how to make it equivalent. And essentially, so the benefit of the urine spot test is that you're looking at the hormones over a 24-hour period. So say your hormones are not coming at a steady rate, you're going to see it the average over that 24-hour period. So you're going to have a much better, much more accurate view of that. Another thing is that, I would say like the patch is probably one of the more common ways to do bioidentical hormones. It's like that little patch you often put on your abdomen, but there are oral forms as well. Those kind of have like for example, actually I have a really nice graph that I could share. Let me just pull this up. So I'm a visual person.
Explain the bioidentical hormones. What's the difference to other hormones you get from a doctor, or is there differences between bioidentical and other prescriptive hormones?
Yeah, so I mean, I would say nowadays bioidentical hormone is sort of more the standard. It used to be that there were hormones that were taken from pregnant mare urine, which is a female horse. And so it was extracted, and it's obviously not the same kind of hormone it's not a human hormone, but it was similar enough that they were able to, get the effects from it, but it had, there were a lot more negative consequences. So bioidentical is made in a lab, but it is identical to the human form. So it's much more, it's synthetic, but it's actually tolerated a lot better. there was a lot, higher risk of cancers and other things associated with the other forms of
So it's
hormone.
an evolved hormone
Yeah. So,
treatment.
and I honestly, there's so few doctors that even prescribe the other kind anymore. It's like bioidentical sort of is just what is done nowadays. So, yeah, it's sort of a thing of the past, but I was going to just show, okay, so let me share this so you can kind of have an idea of, here we go. So this is a map. These two lines, can you see my cursor? Yeah, okay. So these two lines are kind of average hormonal levels. These two graphs are women that are on vaginal, they're doing vaginal like inserts, hormone replacement. And you can see that the rise and fall are very different on both of these women. So say you put in a suppository at night before you go to bed, and then you go to the lab the next morning, it's around 8 hours later. And if you were to do this test at 8 hours, look how wildly different these two values are. The one person, the same amount of relatively the same amount of hormone is gonna look really low in this one and really high in this one. And it's not taking into account of how much hormone was in their body throughout the whole course of time. So you might think with this one, oh, they're not getting enough hormone, which obviously they're getting pretty big doses of it around 4 hours. And the other one, you might think, oh, they're getting too much, but actually, well, yeah, so it's averaging out over time. So that's kind of just an example. And there's, it's the same with progesterone, estrogen, and testosterone. So, so it's not accounting for, especially with the patch, it's a little different because you do it at the beginning of the week, you're going to get a really big dose of it when you put it on, and then as the week goes on, it's going to fade out. So if you don't time it just right, and you're just getting a single measurement, you just really can miss stuff. So I really like the urine test because it does collect over the 24-hour period, and which will make a little more sense when we pull one up, but you can see what's happening with the downstream metabolites. And what I mean by that is like estrogen, it has to be, when you make estrogen, it's actually broken down and cleared out of the system and then remade. And there's different processes of how it's broken down. And some of the intermediates, which are the products between the estrogen and the product that is actually water soluble that you can pee out, there's some intermediate molecules within that process that are actually very toxic. And if you, for example, you could be making maybe just a little bit of estrogen, but you don't clear it very effectively. So you're essentially kind of holding on to it in the system. And so you can have maybe symptoms of higher estrogen, even though you're not making a lot. And then vice versa, you could be making it a lot, but making a lot of it, but you're clearing it really fast. And there's everything in between. So it's helpful to see how the body is clearing the estrogens, and is it clearing it in a healthy way or a not so healthy way. And the not so healthy way would kind of put you at higher risk for potentially developing some type of cancer if you have that in your history, in your family history.
Can I ask a question? So
Yeah.
just to kind of clarify, I think a lot of people are wondering, like, is hormone testing for me? Like, why would it be beneficial? Can't I just take estrogen if I'm having hot flashes to help that? But what I hear you saying is that there's so many other factors to it, that it's not just, are my estrogen levels off? It's, am I clearing things the way I'm supposed to? So that's why like hormone testing is so beneficial, because you look at all those different aspects of it. Because it's not just, am I right? It's not just, some levels are high and some levels are low. And when you say sex hormones, you're talking about estrogen, progesterone, testosterone, just
Mhm.
to clarify for
Yeah.
people. Um, so it sounds like there's a lot of nuances to actually reading the test too.
Yeah, absolutely. Especially the Dutch test. There's a lot to it. But yeah, I think you pretty much highlighted all of the reasons. The one that I kind of mentioned before is seeing, is the ovary still working at all? And then also checking in with the adrenals. Are the adrenals fried? Are they overproducing, underproducing? Because they're part of the hormone picture. Um, and it can help direct treatment in terms of like herbal or bioidentical. And then also, if someone is not clearing their estrogen in a very healthful way, and they have a family history of, cancer or whatever, then they're not going to be a good candidate for bioidentical hormone. And can actually see that. I've actually have an example of a patient that I had. She was still menstruating, but she ended up being diagnosed with cancer breast cancer shortly after we ran this Dutch test on her, and her estrogen was very, very high. And so, sometimes you're really surprised on what you see. And I've definitely, now that I've come to understand it better, I've been able to see, find a lot of things and help correct things before they get to a bad place.
So do you recommend women having a test like to get a baseline before they're even having perimenopausal symptoms?
Well, I mean, if you're not really having symptoms and you feel fine, I mean, it's probably, if you're curious, sure. I mean, I'm a scientist, so I love having information, but like say, if you're not really having symptoms that bother you, I think it's probably fine and everything's going well. But if you're having symptoms, and especially if you've tried some things and nothing's been helpful, or if you're considering doing bioidentical hormone replacement, I think definitely having like a baseline is really good. And at the very least, if you're on bioidentical hormone, you should definitely be doing hormone testing, maybe every 6 months to a year, depending on if you do one and things look really off and you need to adjust it. But if you're on the same dose and you feel pretty good, maybe you don't have to do it quite as often. But I think it's really, really important when you're messing around with hormones, you should check your hormone status. And I just don't see women doing that enough, in my opinion, especially when stuff comes up, and especially if there's spotting or something like that, which is pretty, like at that point, the doctor would probably do a hormone test or, get an ultrasound or something like that. But I think you can prevent that from happening by doing testing, before you get to the point where you're just pumping too much estrogen in the system in someone who's,
I was wondering, I think just going back to basics, when your hormone level is balanced, and where we've through those testings we were able to find certain areas where you can help with hormones, where you can help with herbal supplements. What kind of effect really does it have then? Because I think it's interesting for our viewers to understand how it can help with sleep, with anxiety, with going back to the symptoms. That hormones are so important for us to with everything what we experience really through the perimenopause, how much just a balance of hormones can ease those symptoms many of us experience, like insomnia or anxiety. I notice a lot of for myself, a lot of anxiety coming up recently, more than I ever had, and sleep is sometimes an issue as well. So you realize really with working on this, which you might not even know that it's related, how much it can help you in your daily life and nights.
Yeah.
Right.
And just to dovetail off of that, like I didn't have a lot of typical perimenopausal symptoms, but I had a lot of sleep issues and trouble sleeping. And um, when I did the Dutch testing, and I did it because I had early stage breast cancer, it was my cortisol that was way off.
Mm.
And that's what was really helpful for me to see. And probably may have been good to see like earlier on too. But I think you've made such a good point about the cortisol, Isla, that's
Right.
a really, I think, important piece to look at too.
Well, yeah, and I mean, I would say cortisol is not necessarily directly connected to menopause in terms of like that that something's going to be off because you're in menopause. I mean, I see that in any age that you can really screw up your cortisol. And one of the biggest reasons, besides just general stress, is actually computers and any kind of electronic that's emitting a blue light that is messing with your melatonin, and it affects your sleep pattern and your rhythm with sleep. Melatonin is also another hormone, and it works oppositely from cortisol. So I see that actually being a huge cause of sleep dysfunction. And especially like on the computer, you can get apps that change the light that comes off the screen to a more of a red light. But with your TV, like a smart TV or any TV, really, you can't do much about that. So anyone watching TV right up to bed, I mean, I've definitely experimented that way myself and have noticed the effects of that. And when I get, hooked on some kind of show or whatever, and am watching till late, it really screws you up. So I think, I think the biggest thing, sleep is that's like a whole other topic that is such a big issue across the board with so many people, regardless of age. It definitely seems to get worse as you get older. And I think there's so many factors, besides the hormonal piece. There's just the responsibilities and, the electronics and the, I think, with the hormonal piece, the biggest thing is like the hot flashes at night, which wake a woman up, and then she may or may not be able to get back to sleep. And so I think the biggest thing is that menopause, your temperature set point actually becomes is altered, and so you feel hot at a lower temperature than you normally would have. And so it actually, on a just really functional level, if you're able to keep your room, especially at night, if you're able to keep your room cooler, that's going to help a lot, like having a fan on you, or down comforters feel so great, but they just insulate way too well. And it's like I think women tend to overheat, and I know there's the partner too, and you have to figure out with your partner, if you're sleeping with someone, the temperature. But anything that's going to make you flush, or so embarrassment, heat, all that kind of stuff can trigger a hot flash. And so really something as simple as just having a fan on you at night can actually make a huge difference. And the other thing that can make a big difference is blood sugar. Blood sugar can really trigger, having fluctuations in blood sugar can trigger a hot flash. So keeping your blood sugar more steady is something to also experiment. These are just like kind of basic things that don't have to do with specific, medications, but that's another thing that also some people it can affect their sleep if they, like most people drink wine in the evening, before bed or something, and they feel relaxed and they can get to bed. But what happens is they have a blood sugar spike, and then it crashes in the night, and that actually wakes them up. And so having some protein before bed can help keep the blood sugar more steady. Now, that doesn't affect everyone. I would say it's a smaller percentage of people who it's actually the blood sugar, but there are some tricks. Yeah. So that's a whole other topic, and sorry, I digress.
No, that's great. I'm sure people are going to love that. That's
Yeah.
information
So,
for sure.
but yeah, I mean, I don't know if this is a good time. I'd love to just kind of show what a Dutch test looks like, and I can,
That'd be awesome.
yeah. So I have a, okay, I'm gonna do, try to find the right one here. Okay, so this one is, okay, so this is a 58-year-old woman having horrible hot flashes and just kind of an insomnia, not able to sleep because of the hot flashes, and had been on hormone replacement and wanted to try something else because that wasn't going well for her. So this is just kind of the summary page here, which shows everything all in one. But I'm actually going to just kind of skip ahead here to the main page, which is the one I like to look at. So this is the big page here that shows all the hormones. So pregnenolone at the top is sort of the mother hormone, and then a lot of the hormones branch out from there. The way that you read this test is you can see on the right is progesterone, and there's this purple box which says postmenopausal range, and then there are the two stars with the green zone. So if you were if she was a menstruating woman, we would want her to be in this range. So this is the range for menstruating women, and the box is the range for women that are postmenopausal. If you're perimenopausal, you might be kind of between that box and the star, kind of somewhere in there. So her progesterone, you can see the arrow is her value. Her progesterone looks pretty good. The DHEA on the left, this one doesn't, you can see the DHEA and the testosterone don't have a menopausal range. So those ones are both super low. And then you can see that these are other androgens here, which are kind of the male hormones. These are two others that are, wouldn't traditionally be tested in the blood work. And these kind of show, these are helpful because the one on the right is that it tends to be, if you tend to send more of your testosterone down that pathway on the right, you might experience more symptoms of like hair growth and or hair coming in weird places, acne, kind of those symptoms of too much testosterone. And of course, this isn't her situation because she has low all around, but the reason they show this differentiation is you can kind of see what people's preferences, and you can see the preferences for this other kind. So this is the kind of big important piece often is the three different estrogens on the right here. And you can see that some of these estrogens are coming from the testosterone, and because the testosterone is pretty low, there's not a whole lot, that is going to be able to be converted. Some of it is made directly also in the ovaries, so it's not all coming from that testosterone. But you can see here, she is below the menopausal range in all three of the estrogens. And so she is just like, this is a case where I would say her ovaries are not producing any hormone at this point. Like, ovarian failure, it sounds like a really scary word, but I'm just saying that in the sense of like her ovaries they're tapped out, they're done. Herbs are not going to be helpful. And that was the case with her, that she had tried lots of different herbs and it wasn't helping her at all. So that's kind of confirmed by her results here. If she had been, in this box or, somewhere in this box or even a little bit above the box that perhaps we would be able to help her with some herbs. She might be helped by the herbs, but you can see by this, like, oh yeah, well, that makes sense why the herbs aren't helping you. And then this is the other really critical piece that Dutch, does that's really important. I was talking about the breakdown products. These are the 3 different pathways that these estrogens are being broken down into. These are called the intermediates. And you can see the green is good. That's the pathway. You want the majority of it to go down this pathway. And it even tells you the percentages on the right. The expected percentages. So 60 to 80% of it should be going down this green pathway. And then the red pathway is not a good pathway. That pathway, you can see it can kind of go on and become very reactive, and it says if not detoxified, it can bind and damage DNA. So this is the pathway when women clear a lot of estrogens down this pathway. If this is high for any reason, then that's something that you really want to work with and help adjust and push it down the other pathway. And there are different products that I can put a woman on to shift the clearance from this pathway down the other pathway. And if you look at her percentage, she was 27% of her clearance is actually going down this pathway. So the majority of it was going down this pathway. And when she was on bioidentical hormones, she started having some spotting. And so it kind of makes sense is that she, when she was getting that hormone replacement, a lot of her estrogens were actually being cleared down this unsafe, unhealthy pathway. And so if we were to put her back on bioidentical, which really would be the only way to help her hormones at this point with how low they are, then I would also want to put her on a product that would help shift and promote this other pathway, this safer way to clear the estrogen. So this test was really helpful in this case. This last step is the last step in clearing stuff out of the body. And if any of you have heard about methylation, this is a methylation step, and this dial lets you know if she does well, if she's good at methylation or not so good. And she's actually good at methylation, so that last step of clearance, she does well. But if she were not good at it, we could help promote that with different products so support methylation, which is a whole other topic. But anyway, so I'm going to scroll down to the cortisol because this was also really significant. So this one, you can see she's making plenty of melatonin, so melatonin is not the issue with her with any of the sleep stuff, but you can see her DHEA is very low, and this metabolized cortisol, that's basically her total cortisol production. She's making hardly any cortisol. And if you look at these graphs where the black is the high end of the range and the other black is the low end of the range, and the red line is her value, she's barely in the range. And so also, in addition to her ovaries kind of being tapped out, her adrenals are also pretty tapped out. And so, for her, definitely supporting the adrenals is going to be really critical to getting any kind of hormone production happening. And then, she might be one that, if done in the right way, monitoring this, that we could probably get her back on bioidentical, but have her at a lower dose and then give her some things to help push that other pathway so she can clear the estrogens in a really safe way. So this is a really good example of someone who's just kind of low across the board. And then I'll just show you real quickly, there's another example of someone who's really high. And this
what I find very interesting is that it's not about, do I put you on hormones or not? It's really like that even putting someone on hormones can have a very negative effect, right? And
Yeah.
really finding the balance in all these different areas. That test is amazing to really find the details, the
Yeah.
small stuff,
Totally.
right?
Yeah, yeah, there's so many nuances, and it's not just yeah, cut and dry. And then there's also the tweaking, because sometimes, there's this real nuance with prescribing hormones too, that, finding the right type of administration and the right dosing can make such a difference. So this is a woman, same thing, I'm going to just kind of skip ahead.
Before you go on here,
Yeah,
there was one question that I think you did answer before, but
yeah.
just in case, someone was asking, are bioidentical hormones the same as compounded, or are you saying that bioidentical can also be a prescription from a pharmaceutical?
Both. So bioidentical just means that it's synthetic, it's made in a lab, and it's designed to look exact, it has the exact same chemical structure to our own hormones. Within that, there are some products, bioidentical products, that are like patented products out on the market that you can purchase, kind of already formulated. And you also can have it compounded, because sometimes the ones that are already formulated, don't quite work for your needs. So having it compounded, you can really be more specific. So that's definitely more of a nuanced thing to have it compounded. And just like with, thyroid replacement, it's, each person responds differently, and some people just do totally fine on the standard thing, and other people do better with the compounded. So yeah, and just in general, I say that the estriol, which is the E3, the one on the right, that one is the safest of all the hormones. So if you're kind of, skeptical, or if you want to try it, but you're kind of nervous, that one, it's not as potent. The estradiol is 10 times stronger, so you're not going to get the same, effect. But especially women who just have, vaginal dryness is their big thing, and they just, like, it's not as enjoyable intercourse and stuff like that. Sometimes in those cases, doing just a suppository can be enough to, they're not dealing with the hot flashes and some of the other things. So just having a nice suppository, or they have frequent urinary tract infections, and having some vaginal estrogen can be really helpful to create a little more elasticity in the tissues. And in that case, you sometimes you can get away with just doing the estriol. You can get estriol suppositories. Sometimes you need to do both, but it's definitely safer. So if there's family history of any kind of breast cancers, estrogen sensitive cancers, then but they're dealing with this horrible vaginal dryness, it's typically very safe to do like an estriol vaginal suppository, because you're not really getting it systemically, and it's the weakest of all of them. So some doctors are comfortable with that.
Awesome. I think all of that's
Yeah.
confusing to people. So thank you so much.
Yeah, totally.
And I just want to do our little disclaimer too of this is not medical advice for anybody.
Right.
This is just information, and please see your medical practitioner if you are having any questions with that. Or we're also going to give Aylah's information too. Like, she does telehealth and would be awesome to work with. But
Yeah.
just our little disclaimer there.
Yeah, thank you. So this is actually a 57-year-old woman who at the time was not really experiencing menopausal symptoms so much. But she was having, she had actually PCOS, which is where she was having symptoms of excessive testosterone, actually, where like hair growth, where she had to shave, like a lot of women, some might shave their chin, and some other symptoms, and really horrible migraines. So we were expecting really high testosterone. That was not the case. It was actually her estrogen And so so she's 57, so she's perimenopausal, so she should be like between the star and the box, and she was just off the charts on all three. I mean, this is higher than I see menstruating women. I've never seen a menstruating woman with this high levels. And then if you scroll down and you look at the clearance, well, in this case, actually, she has a lot going down the 16-OH pathway, which is also not a safe pathway. You really want all of it going down this pathway. So I actually consulted with the people at Dutch, and they were extremely concerned. They were almost wanting, to do some like serious intervention, just like really concerned with her risk for cancer with the estrogen at these levels. And we decided that I was going to try a product called DIM, which helps to lower estrogen, and it also shifts it down to that safer pathway. And we were going to retest in a couple months. And we did retest, and I don't have the results here, but we were able to bring it back into the normal range, although then her hot flashes got worse. But actually her migraines went away and a lot of things shifted. So migraines are not necessarily like a typical menopausal symptom, but I've definitely seen in a lot of cases, especially with high estrogen, that women who tend to have cyclical migraines, estrogens, often the culprit. And by helping lower the estrogen, you can really affect change there and help significantly with the migraines. So there's just one last one that I'm going to show you. This is also a Dutch, but it's a slightly different test. This is called cycle mapping, which is where you actually collect all month long. And this one, see, it looks very different. It looks at just the estrogen and the progesterone. And this is looking at it over the whole month. So you can see if a woman's ovulating, and you also can see if she's doing the normal pattern. So the black lines, the black dotted lines are the normal range. So this is the high end of the range. This is the low end of the range. And then these are her two values, and that's the estradiol and the estrone. And so you can see you're supposed to have this kind of one big spike, and then it goes down and kind of levels off and then goes down again. And you can see here, she had her spike, which wasn't super big, but definitely spiked. And then she has like a second spike kind of at the end, and it's not really going down like it should. And she was having cyclical migraines, really horrible migraines. And so this test was actually really helpful because you can see it a lot better here. What we did is we looked at, okay, so at about day, what is this, like 22, the second half of your cycle, I want you to start taking some DIM, which will help lower your estrogen and prevent this second peak from happening. And she did, and her migraines totally shifted. So another case where, not necessarily having to do with menopause per se, but another case where we're looking at hormones over the course of the month can be really helpful, and you can really target where to use a supplement or herbal product to help shift. So yeah. And then same thing, like low libido too. We've been able to confirm that it's the testosterone and bring the testosterone up. So there's lots of different situations where I use it, but yeah, I love the Dutch testing. I find it really helpful. I definitely have, can help women without the testing, but I do find that I can be more specific, and I'm not just kind of guessing at something, because women just respond so differently to different products. So
I think that's like one of the biggest keys is every person is made up differently. We each have our own chemistry. We're going to respond to different things differently. that this just gives the realization of how many nuances there are within all this. And, you know, you hear all these recommendations. Oh, try this. Oh, try that. Oh, do this. This worked for me. But I think this, I don't know, for me personally, just really shows how helpful the testing can be. But then it's also finding the practitioner that can interpret the test.
Right. And
And
you mentioned before about, like, I know one of your questions was like how to get the test and whatnot. And I think that you actually had a patient who was going to just order it themselves online, which I don't actually know much about that, but you can order it directly from them, I guess. But it was pretty pricey.
yeah, what I found is if they were going to order it online, it was, I don't remember the numbers, but at least $100, $200 more than if they actually went through you.
Right.
And then they have a practitioner they're working with who can help guide them through all the nuances of the test. And
Right.
yeah,
Yeah, we don't upcharge on we don't add anything to the price of the test.
no, it
So
was less expensive. It was
yeah.
some.
Yeah, and the Dutch Complete, that when if you just look at the hormones, it's 150. If you look at the hormones and the cortisol, which if there's any sleep issues, you know, I always want to add that, then that's 250. And then actually, I didn't even show you the end of the test where there's a whole bunch of other markers that it includes, like melatonin, dopamine, norepinephrine, epinephrine, B6, B12, and yeah, like several more. So you get a lot of value from it.
Mhm.
Sorry, Angela.
We had another question.
Yeah.
It's about the product DIM you mentioned a few times. Michelle asked, I've taken a product called DIM for 4 months straight and did not see any improvements. But she also hasn't done any testing in her second comment, she said. Could you address?
Well, I guess not knowing what her, you know, what she was taking it for and the dose and all that, I guess I can't really say. But yeah, I mean, I guess what I can say in general is that it takes about 3 months to shift hormones. So when you're trying to affect hormones, you got to give it at least 3 months, you know, before you really notice anything. And DIM is something that you may or may not notice symptom wise, depending on, you know, what you're trying to affect. But I have seen that you have to be careful using DIM, especially in the menopausal, perimenopausal range, because you can actually push the estrogen too low and then you'll get a bunch of hot flashes. So you have to be careful with that. And, you know, sometimes it's like your risk benefit, you know, if you're dealing with cancer and you're trying to keep your estrogen really low, so you're not feeding the cancer, then, you know, then it's worth it. And in other cases, there are other products that can help shift that pathway that I was showing you about, but don't necessarily bring the estrogen down. So depending on the situation, you know, if a woman has really high estrogen, I'll go for the DIM. If she doesn't, I'll go for this other product, which also comes from, you know, the Brassicaceae family, the like broccoli and cauliflower. So yeah. So sorry, I don't think I can answer that specifically. Yeah.
Thank you very much.
Yeah.
Yeah, I think that was helpful though.
Mm-hmm.
Yeah. So
I don't see any other questions coming in. Did you have any, Angela, off the top of your head? And was there, I always want to ask too, is there anything, Aaylah, that you really want women to know, or something that hasn't come up that you want to make sure to really put out there?
yeah, I mean, so obviously, I'm not speaking from experience. I haven't, you know, gone through this shift myself, and but you know, I had a teacher who I just loved the way she talked about it, and it's really like this beautiful initiation. and this beautiful transition for women that I think some women, kind of dread or see it as a really negative thing. But she talked about it like, kind of like the veil is lifted, and when you're still menstruating, it's like biologically there's still this possibility of getting pregnant. And so it's like women, we can be on our best behavior. It even happens within the month, when you're still potentially fertile, maybe the mood is improved and you're sweeter to be around, and then the menses come and it's like, the veil comes off. But with menopause, it's like it's gone. Like there's not that, you don't have the inhibitions as much. It's like it's very liberating in a way. And
down, right?
right. And like it's like, I guess, as much as you can, just really embracing that shift and that transition into, really being an elder, and all the beauty that comes with that. And I think that some women definitely have a more difficult time getting through it than others. I mean, I see women who just have absolutely no symptoms, and women that are just miserable. So, I think that there's definitely, I think that I wouldn't be scared of, there's definitely lots of alternative solutions, but for the most part, I don't think that you need to be scared about, bioidentical. There's just more and more information coming out that actually it can be protective for a lot of ways. So it's just so individual, and finding your own, flow through it, I think is going to be really unique to each woman. But I think, if you're miserable and having hot flashes all night and you can't sleep, like get some help, because there are things that can help you, and you don't need to suffer like that. And there are ways that you can do it that are safe. But with that, I would say, if you're going to go that route, definitely get testing, so you make sure that you are safe the way that you do it.
Mhm. That's beautiful advice. Yes. And I really appreciate you addressing that piece of maybe shifting the mindset around this stage in life of, it really is an opportunity in some ways to, you know, what is important to you and how do you want to create this life that is now you get to maybe form and have more control over this later part of your life, and how do you want that to look, and really stepping into your power. I don't know, I guess I just want to
Yeah.
shift that
Totally.
mindset around that it's not all negative. It's a
Mhm.
natural phase that needs to be honored and embraced and really celebrated, I think.
Right. Yeah, it's like a lot of self-acceptance too, which,
Mhm.
I think happens, even when women get pregnant, that shift that their body goes through. There's a lot of self-acceptance that comes through that process. And I think it's the same with menopause, because the body changes, and, it's like, you feel like, I mean, I've heard a lot of women say it's like you look at yourself and you just don't even recognize yourself. As you get older, all these weird growths come, and the body weight distribution changes, and you just realize like you're really not your body, and that's what it comes down to. But definitely it can be a big transition to make, and it's kind of like the opportunity and the chance in your life to kind of focus on the other parts of your being and let go a little bit more of that kind of external piece, which is really challenging, but yeah, it can be done so beautifully. So
Right, and be really healing.
yeah, yeah,
Yeah, I loved just the description or what you explained about the Dutch test, that there's so, like you said, there were so many nuances. For me today, I realized just through a test, you can already adjust so much in different levels. And I remember my mom, she didn't really have a lot of help, and she didn't ask for a lot of help. And there were mostly not the natural treatments available as well or not known. So I think we are in a time where we have a lot of help on a natural way and Western doctors, and we just need to embrace it and start talking about it. And that's one of the biggest thing I have, that I would love to talk about it and be honest about it, and just support each other, because we all go through this at some point.
Right.
So,
And I think, I can't prove this, but I think theoretically, and maybe I'll observe this a little closer. I feel like if you were to start supporting yourself a little earlier, like as soon as you started notice shifting, get on some maca, get on some of these like supportive flaxseed, all these things,
yeah.
that maybe, rather than waiting until it's really bad and then you don't have as many options, that maybe you could kind of extend that period a little bit more. But yeah, so.
Yeah, no, fantastic. Thank you so much.
Yeah. Yeah, thanks for having me. This is fun. And and I am at Namaste Health Center. So and I'm actually doing in-person and Zoom or phone, whatever you're comfortable with. My initial consultations are usually about an hour and a half to 2 hours. They're pretty extensive. And I kind of go through your whole health history just to, fit all the pieces together. But if I will say that I guess I'll talk to Cindy. Maybe we can like do a little discount for people who are here. And another thing that you could do is if you want to do the hormone testing, you could potentially come to Namaste and get the test kit ahead of time and do the testing. So then our first visit, we can kind of jump right in and sort of like skip that. Usually I would kind of do an intake and then order the kit, and we do it on a follow-up. So that would be a way that we could kind of just jump right in. I'd be okay with that. So maybe I'll talk with you, Cindy, afterward, and we can figure out something to send out an email or something.
Yeah, that would be amazing. And we'll post it in the comments under this talk. And we'll make sure and post your information so people know how to reach you too, because you're an amazing resource for all of this. And we actually have people from all over the world in the group.
Great.
So I'm sure they can work with you telehealth too, right?
Yeah. Well, and yeah, Zoom or phone. I've done with some international people. I've done WhatsApp, I've done it all, but yeah, Zoom, I really like working on Zoom, probably the best, because it's just, easy to use with the screen share and stuff like that. If we go over labs together or something like that.
And there'd probably be a way they could get a test. You could send it or something.
Oh yeah, that would be the tricky part. Yeah, I don't know.
You can just mail it
to mail it. Yeah, they could mail it to Dutch potentially.
Yeah.
They'd have to get a test kit to them, but so we have to figure that piece out.
I'm sure it's all workable.
Yeah.
Awesome. Well, yeah, we will make sure and put all of your information so people can contact you in the comments under here, and any other discount or whatever you want to offer people here would be, I'm sure, so appreciated.
Yeah.
And if people have questions, even after this recording, put it in the comments and we'll make sure and address those. Yeah. Well,
great.
Thank you so much.
Yeah, thank you.
Such, good information, and needs to get out there. And it's really generous of you to give time like this to educate women. So we really appreciate you.
Oh, it's really nice that you're doing this, actually. What a great resource for everyone.
We hope to have, future talks. I think our next one is going to be nutrition based.
Yeah. Didn't we already decided on which day?
I think October 8th.
October 8th, right? Exactly.
7 p.m. I've been talking with someone who works as a sex therapist on maybe doing a talk on sexual health, which would be awesome too. So we'll definitely have upcoming talks, and
So yeah, the next one looks like we're going to do on October 8th. And it's a very, very good friend of mine who's just really an expert when it comes to nutrition. And she will bring the nutrition part, how we can support really this time in our lives with good nutrition. And she lives in the Philippines, in Manila. So she will be then Friday morning at her house. So yeah, I'm excited to have her for next month's talk.
Awesome. Well, thank you, Aaylah. This has been just amazing. And yeah, I appreciate you. And thank you, Angela. And everyone, have a good evening. And I will stop the Facebook Live, but the three of us can stay on and connect for a minute if you like. So take
Thank you.
care. And yeah, everyone have a good night.